Welcome back in, everyone. I'm joined by Dr. KENDRA PARADIS from St. Joseph's Family Medicine. Thank you so much for being with us today.
Thank you for having me.
So we want to talk about sort of back to school time as it pertains to family medicine and personal health. But first, just tell us a little bit about, the types of patients that kind of come through your door and how you work with people.
Sure.
Yeah.
So I'm a primary care physician. I do family medicine,
Yeah.
and I'm a doctor of osteopathic medicine. So I see patients from cradle to grave, really all ages,
Yeah.
for all of the care that they need. Primarily, that's focused on preventative care.
Mm-hmm.
I'm really passionate about cancer screenings and preventing diseases.
Yeah.
But it's also about managing chronic illness and acute problems, things
Yeah.
like diabetes, high blood pressure, cholesterol, and acute issues, skin problems, lung diseases, all these things that come up on the day-to-day.
Right. So, I think when people think back to school, they might not immediately think, oh, family medicine or primary care, but there is a health aspect to the back to school season. So talk a little bit about, when we talk about back to school safety, how that translates sort of through you and what you do.
Yeah.
Yeah.
So a lot of school-age kids need to have a sports physical in order to participate in school sports.
Yeah.
Their primary care provider can be the one to do that. So if they're a family physician or their pediatrician, so making sure that they've had their well child check within the past year, make sure that they're safe to participate in sports. The other thing that's really important is preventing disease spread. So kids in a confined area are going to spread illnesses.
Yes.
Not everything that we can prevent, but things like flu, COVID are really important in preventing. So making sure that they get their vaccinations on time this fall.
Yeah.
And then there's a whole slew of other viral and bacterial illnesses that children can get that can cause outbreaks, and making sure that they're up to date on their routine preventative maintenance immunizations can help to prevent those.
Is there also an element of sort of reminders of just some healthy practices and healthy habits that can carry you through the school year in a better way?
Yeah, there's a lot that we do at well child checks and preventative exams. We're talking about preventing injuries in sports. We're talking about healthy eating and sleeping habits, and just general guidance and anticipatory guidance for people that are raising children.
All right, so a lot to talk about when folks are maybe doing a back to school health appointment.
Yeah. It's also about the parents,
I was just gonna say, self-care,
making sure that parents are taking care of themselves, that you don't forget that you need to put yourself first sometimes, getting your annual visit so that you can make sure you're up to date on your screenings. And setting, I think, back to school is a time of change, maybe resetting and saying, okay, what are our priorities? Things like self-care for the parents, reading, doing some exercise, having a hobby that they enjoy.
Yeah.
That teaches your kids to really value those things too. And trying to sit down with your family at least once a day and ask, what did you do today that was really interesting? Who did you help, or who are you kind to? What did you learn? A lot of kids, if you ask them, how was your day, they'll say, oh, it was good, and move on. So you've got to ask,
that's all you get.
You've got to ask really detailed questions to get good responses.
Do you find that people don't maybe think about their health in a back to school sense? Is that something that we need to flip the script on a little bit?
I think all year round it's really important, but back to school is a good time. You're going through a period of change. It's a good moment to kind of reflect and say, okay, did we have all of our ducks in a row right now?
All right. Well, certainly wanting to set the example for our kids that you don't put your health last.
Yes,
that's important.
Very important.
All right. Well, thank you so much for giving us your perspective today. We certainly appreciate it, and hopefully provided some insight for folks out there. It's about more than backpacks and pencils.
It's absolutely more about that.
All right. Well, folks, thank you so much. We will be right back with our extended forecast. Stay with us.